Hello, Josh Conway with Bullpen, and we are here at BIO International Week in Boston 2025 at the beautiful facility of EPAM Continuum. And I am here with Doug Cohen of Medtek. Thank you for joining us here, Doug.
Thank you for having me.
If you could tell me just a little bit about yourself and how you got to Medtek.
Yeah, great question. Long story, but we'll try to keep it short. So my background is mechanical engineering. I graduated from MIT here in Boston.
Oh, awesome.
Long time ago. Moved back to Columbus after being here for a few years and worked in a family business, which we grew up, sold off to a private equity group. And it afforded me the opportunity to change gears in life. And my MO in life is devices to help people.
Awesome.
I started a company to do braille displays for the blind. And then along the way, I was looking for some work for a business partner of mine to do, who's our COO now, and who's also a fiber optics guy and Stanford degree and really a lot of experience in the optics space. And we came across this technology out of Ohio State that deals with fiber optics and cancer detection. And what we thought would be just a coffee conversation at Ohio State turned out to be this 2-hour presentation that we sat through. And then we walked out of that meeting and Andy said, you know, this makes sense. It's really straightforward. It could do a lot of things. I see how it works, but I'm not going to do it without you. And I said, starting a med device company wasn't exactly what I had in mind, in terms of devices to help people, but how many opportunities do you get in life to have a meaningful impact in the cancer fight? And this one could have a meaningful impact. And so we got together and we said, okay, what skills do we have? What skills do we need? And we really started scouring the nation to build out our team and pull in the resources that we wanted. And with that, we've built out a tremendous team, and we've been very capital efficient and really engaged the team with meaningful equity such that we're all aligned and empowered to move the company forward towards success.
And I have the benefit of having watched your pitch. Great job, by the way.
Thank you.
And I got excited about, as a layperson, I got excited about the technology that you've developed and are ready to bring to market. Tell us a little bit about Medtek and what it does.
So Medtek is commercializing a fast cancer detection technology that was invented at the Ohio State University and the James Cancer Hospital. The technology is based on mid-infrared light, where we're detecting unique signatures in the mid-infrared spectrum of lipids and proteins that allows us to apply our machine learning and AI models to those results and give a cancer, non-cancer output. Our initial focus is skin cancer detection. It's non-invasive. It's lowest hanging fruit, big market. And we're looking to put a device in primary care where we can touch a particular lesion on someone's body and in 30 seconds give a red-green output such that we can really change or improve the path of care by reducing the roughly 80% of skin biopsies that are performed every year that come back negative. So there's a big opportunity to improve health care, reduce patient anxiety, reduce additional office visits by reducing that 80% of negative biopsies.
And one thing that stuck out to me, certainly as someone who knows people within my family with skin cancer, who've had skin cancer procedures, but one thing that stuck out to me in listening to your pitch was the number of varieties that it can detect, and that seemed to set it apart from what's currently done and the way that detection is being executed currently.
So one of the beautiful things is we're looking in mid-infrared light, which really gives us different signatures than what visible or near-infrared light would give us. As a result, we're able to detect not only melanoma, but squamous cell cancer, basal cell cancer, and we're also ethnicity independent. We don't care what skin coloration looks like because melanin content really doesn't show up in the mid-infrared, or if it does, we're able to cycle it out very nicely. So it's irrelevant to us. So with that, we can glean a lot of information that really other technologies don't have the ability to, which gives us the unique ability to be very accurate in our results.
Wow. So you've already solved, it sounds like, through your technology, some very big problems. What are the problems that you are looking to solve for the company right now? What are you working on? What are you working towards? What's the next step?
So we like to say that up to this point, we have de-risked the company. In each step of the way, as we pulled in investors, we've had de-risking points. And now we feel like we've really de-risked the technology to a point of we're done with the development. Now it's more of shifting to an execution stage. Our next step is do a beta device build, which really takes our technology, takes our initial alpha devices, and turns them into something that we can go to the FDA with and get approved. That's the next step. After that, then we're going to follow up with finishing out our data sets, really finishing building the number of data points that we have, the different types of skin lesions, so that our machine learning models are optimal. And at that point, we go to the FDA for approval. That whole process, we're looking at 2 to 3 years to FDA approval.
And is there a funding goal toward that process that you are looking for?
Yeah, so we're looking at $1.5 million to get us through our beta build, and another $5 million gets us through FDA approval. We do have several follower investors aligned right now, so if we would have a lead investor, we could do this whole thing as one series raise, which would simplify things. But obviously, with the funding environment, things don't always go according to plan. So we've broken it up into a couple milestones.
It seems like you've done a great job of, like, as you say, de-risking each step in the step that you're currently at. Brings me to my last question, is what's your ask of the Bullpen community? How can Bullpen and the members of Bullpen send resources to you? Who would you like to be connected with?
So, of course, the immediate ask is the lead investor. If we get a lead investor of $1 million or more, then we have everything we need. We can get the rounds completed. But beyond that, it's really what Bullpen has done for Medtek in terms of expanding the network and making the connections. We were part of the On Deck Moneyball program that just completed, and it's been phenomenal. The resources, the people that have come to the table to help us have been awesome, led by Michael Hill, of course, with his 27 years experience at Medtronic, but also Mark Stevenson, Amelia Newberry. They've been phenomenal people to work with and really help us refine our message. The pieces were there. It felt very reassuring that the path that we're on seems like it aligns with everybody, but really telling that story in a more meaningful way has been the end result of that. So Bullpen continues to help us expand our network, and that's really also what we're
that's
looking
awesome.
for.
Yeah, well, as a audience member during the pitches, your mission and your product and you connected with me. I was really excited to see what you are doing and what Medtek is creating. So I wish you all the greatest success in building upon what success you've already had and done.
Well, thank you, and thank you for the opportunity to talk today.